Now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
And from one boomer to the other, good morning. I wonder how we got that expression, baby boomer. Dr. Ron Zuckel, do you know about that?
I think it has something to do with the population boom, explosion after World War II.
I knew there was a medical reason for it. Welcome to Boomer Life on CL 650 Boomer Life. What we do here is we celebrate the boomer lifestyle each and every Saturday, and we have a pleasure of talking with Dr. Ron Zuckel from BCPerio. I'm glad to have you back in the studio with us, Ron.
Thank you, Tom. Nice to be here.
It's good. Some days it's good to be anywhere, isn't it? But you're smiling. I'm smiling because I've come down to your office a couple of times, and you make me happy going down there. Our producer's been down to see you. Mm-hmm. Let's just pretend that somebody hasn't heard this program before. And they go, but I know this name. I've heard this Dr. Ron Zuckel chap. I've heard his name before. I've heard him on the radio for years. You're the same guy, right?
I think there's only one of me.
I think, well, we don't need two. One's enough. So you've been doing this now for quite some time.
Quite a few years, yes.
Can I ask why?
Partly because I enjoy it. Partly because it brings people to my door who I can help. And it just works as a symbiotic relationship where we are able to continue business and do some of the things that we love to be able to do and help people out.
Here's a question for you. Tell me what you've been doing for the past month and how it makes you feel. You probably had some new patients come to see you with some new problems.
Yeah, routinely, and that's a great thing. It's one of the beautiful things about what I do is that everybody is a little bit different and comes in with a completely different set of criteria, of concerns and problems, and an environment which is somewhat difficult to handle under some circumstances. And to be able to do the detective work to find out what you have to do to make everything right, correct it, make it look like it never had a problem in the first place, and then put it in an environment that allows it to last, hopefully, for the patient's lifetime. That is fun.
Well, like we said, you've been doing this in Vancouver for many, many years. You've seen all sorts of different patients. Let's just tantalize somebody. Let's give them a little teaser. You've worked with some sports celebrities.
Yes.
I've heard you've worked with some movie stars.
Yes.
Okay, now, because I know I can't ask you who they are, and I won't ask, but can you tell us, like, let's say with an athlete, what kind of problems have you seen with an athlete coming in?
Hockey players predominantly. Yes.
Pucks in the teeth?
Very much so. Or hockey sticks in the teeth.
Ooh.
Sure. Or sometimes an elbow. A lot of accidents. Unfortunately, some of these are intentional things that people get into from time to time. And they end up with accidents. We call it a workplace accident, really, in spite of the fact that it might be sports.
And you've seen some celebrities, some movie stars come in?
Indeed. Vancouver is Hollywood of the North.
Absolutely.
And when people enjoy a beautiful cosmetic result, they often find their way to my door.
When somebody first gets into the acting business, do they come to see a doctor such as yourself to say, here, make me look beautiful, Doc?
I've had a number of people just like that over the years, probably over the last 25 years. We've had people who are aspiring actors or actresses who said, you know something, I think we need to do something here in order to increase my potential to survive the casting routine and when they have an audition to be the chosen one, if you will, for the part. So people who look better tend to get the parts more frequently, unless they're looking for a specific type of an individual for a part that doesn't look really good.
Well, it's springtime. It's almost summertime here on the West Coast, and that, of course, means outdoor barbecues and parties and families getting together, lots of picture taking. And inevitably, there's always somebody that's hiding behind either their ham sandwich or their hand or a fan or something, right?
You mean they're trying to mask what they look like?
Yes,
what the teeth
they
look
are.
Like?
Yeah, so I'm thinking because summertime is just around the corner, now might be a good time to drop down and see Dr. Ron Zuckel.
Could do that. And by the way, the people who put their hand in front of their face to hide what they look like actually draw attention to their mouth.
That's right. Why are they hiding?
Yeah. What's the reason? So people are looking for why they're putting their hand in front of their mouth. They're masking their smile. That, unfortunately, without intention, is drawing attention to it.
Let me ask you this question, and again, now I won't give any names, but I worked with a fellow in radio once, and the poor guy had some bad teeth in the front. So what he used to do was to chew gum and put the gum over, I guess, trying to hide them with the gums. So he would have been a good candidate to come and see you, right?
Yeah, he would have been.
I don't know what his problem was, whether his teeth were worn down, he was just trying to hide them, or they were I don't know. But he was hiding.
People do a lot of funny things to kind of make things look as right as possible.
Now, people want to come down and visit you, and you have 2 offices, by the way, right?
Yes.
You have one in Vancouver, which is on Willow, which I drove by today.
Yes.
And thank you for waving from your office at me. That was very kind of you. I know you were busy, and you said to the patient, just hang on a second, I have to wave every time he's going by. But the address is 777 West Broadway, so you're up on the 5th floor.
5th floor, 501.
Very easy to find. There's lots of parking around there. And if you want to call Dr. Ron Zogel to make an appointment for a consultation, his telephone number in Vancouver is 604-872-0222. That's 604-872-0222. Say that you heard him on the radio and you'd like to make an appointment to find out what the heck's going on in your mouth with Dr. Ron Zogel. You can find out that pretty darn easy, right?
Well, that's what we do. That's the first thing we do is take a look and see what's going on and listen to what you have to say and find out what's important to you. And
I know what you do. I know what you do when I go down to BCPerio to Dr. Ron's office. And Dr. Ron Zogel, I come in for my consultation. You sit me in the chair. Nice to meet you, doctor. How are you, Tom? Yes. Then you start. So what do you do?
Well, one of the first things we do is take a radiograph. And for a lot of people, that's called an X-ray. And the X-ray is a comprehensive look at what's going on in your mouth in a very large format, so we can see everything that's going on in there. And once we have that, and we take a look inside your mouth, we have a pretty good understanding of where you're at and where your problems lie. Now, we don't necessarily say a lot at that point, but what we want to do then is sit down and talk with you about what are your concerns. Why did you arrive in the office? What is it that's bothering you about your teeth that you would like us to look at and address? Now, we may add stuff onto that because of what we see clinically and in the x-rays and such, but that's the discussion process. But I want to concentrate on really the driving reasons for why people are showing up and why they're there. So we're going to find a solution that makes sense to you, that will give you the comfort and confidence that you'll be treated the way you'd like to be treated, and you'll walk out with a happy smile on your face.
It's like the old story I'm thinking about years ago. Our moms or dad, the TV wasn't working, so they'd call the TV guy. And they'd say, the TV's not working. You say, well, I've got to take it to the shop. But if people don't come down to see you at your place of work, at your office, at BCPerio, you're not going to know what's the matter with their teeth because you can't just take it over the telephone.
I can't. And I can't go to their house, actually, and take a look because I don't have the equipment to help me understand the nature of their issues.
I like that idea, the traveling dentist. We should work with that. So not only do you make people better, give them nice improved smiles, but you travel the world. You have people from around different parts of the world come to see you.
Yes.
Yeah, give me an idea of where people are coming to see you from.
Oh, good Lord. Let's try India.
Wow.
Let's try Taiwan, Switzerland, England. Lots of people from the U.S., Mexico. Over the years, there's been a whole bunch of them. Italy.
This is now I find this really interesting because I'm sure in all these different countries you've talked about, there must be somebody there who is qualified to take care of them. But yet these people from around the world want to come to Vancouver and be with Dr. Ron Zogel.
You wonder that. I know that I've lectured all over the world and such, and people hear me, and part of it is a confidence that comes when you go and you show what you do, and you show how you do it, and you show the results to professionals, and they talk, and somebody has a particular problem that's a difficult thing to treat, and they say, I saw such and such, gave a presentation on just that type of a problem, and he got a great result. And to some people, traveling intercontinentally is not an issue. And for those people, great. Not everybody can afford to do that, but for the people who can afford to go, they want to go where they believe and understand that they can have a solution to their difficult problem.
Now, if you're having a problem inside your mouth, and who isn't these days? I suppose there are one or two people that are not, but a lot of people need to have their teeth seen to. Number one, I think a lot of people don't go to see their doctor every 3 months or so for a checkup.
I think people do not.
No.
We've found that the more people will go on a regular basis see their dentist for checkups, the less money they'll end up spending on their dental health.
Makes sense.
It does.
So if you want the right answer, like what the heck's going on in your mouth and can we make it better? Yes, we can. I want you to go and see our very good friend, Dr. Ron Zogel. Now, Dr. Ron has 2 locations. His office, by the way, is BCPerio. 2 offices, one in Vancouver at 501-777 West Broadway. That's 501-777 West Broadway here in the city of Vancouver. His telephone number downtown, 604-8 604-872-0222. It's actually not downtown. It's on the way to downtown. It's on Broadway.
It's on Broadway.
Yeah, you're by the fancy hotels there. 604-872-0222. In Coquitlam, if that's more convenient for you, you can call Dr. Ron Zokel at 604-936-8244. That's 604-936-8244. Or just drive by and see if he's in the office. It's number 250, 1175 Johnson Street, number 250, 1175 Johnson Street. And your website is bcperio.ca.
It is.
And we'll be right back with more on Boomer Life with Dr. Ron Zokel.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.